I'm here today joined by Josh and Paul via Zoom, David Lehman, Economic and Community Development, and Susan Beisowitz. And they're here with me because we're going to spend a fair amount of time talking about our reopen strategy and the protocols necessary to be able to reopen and keep us safe. And David's been working closely with the industry groups to figure out how to do this. And Susan, as you know, has represented hundreds of small businesses, has a unique perspective there. First, if I could, let me just quickly go over the metrics we've got here. I think you see, compared to yesterday, there are a lot of similarities. That is, test performed is continuing to stay at a higher level, which is important. The percentage of positive cases is relatively low. That's very good. And the current hospitalization is probably the most important metric we have for reopening, continues to stay low or negative, which is very, very good news for us. But I just wanted to, before we talk about the protocols and reopening, remind you that this is about the metrics, and you heard about yesterday from Indra and Albert, the 7 metrics and what we determine in terms of the virus that allows us to have some confidence going forward. But it's also about behavior. It's metrics and behavior, and that's what I'd like to focus on just for a few minutes before David leads us through. You know, it's worth remembering that here in Connecticut, as well as places like Georgia and Texas, that most of the stores and the consumers had already closed down before they had their stay-at-home orders in place. And that's because consumers didn't feel comfortable and stores didn't feel comfortable. And now here we are on the other side, perhaps, of the pandemic, at least the worst of the pandemic, and you've got places like Texas and Georgia that have reopened in a big way. But it's worth remembering, again, the behavior. Many of the stores, I think David told me a third of the stores in different parts of Texas and Georgia did not open because they didn't feel comfortable. And many of the consumers did not go back either. So this is the balance we've got as we try and convince you of the public health aspects of what we're trying to reopen. And there are some, nervous things in terms of behavior as well. I mean, even in those places that opened quickly, a lot of young people came pouring back into some of those venues. And there have been some spikes in terms of the infection rates. So this is what we got to watch carefully. And as I think about Connecticut, I've been pretty proud. I think we've really focused on the stay safe, stay at home protocols, especially for our senior population, the most vulnerable population. But, you know, there is some slippage as well. I noticed this past weekend that our beaches were packed. It was very warm. Katie Dykes, our commissioner, pointed out that they had to turn back a fair number of automobiles, and we had to be careful about the social distancing there. I was talking just this afternoon with James Ravella, our commissioner of public safety. And as you know, our transportation, car traffic was down 40 to 50%. Now he estimates it's probably down about 30 to 40% as people start getting into their cars again. But what's more disturbing is there's some reckless behavior as well, and that is that the number of car-related fatalities is up by 18 people. I think that's about 28% compared to this time last year. People are driving faster and a little more reckless, and we can't be reckless when it comes to the virus. You know, that said, we're trying to come up with a prudent way to reopen and reopen safely. One of the metrics I looked at for guidance was the CDC, Center for Disease Control, and what the federal government guidance was. And when I found out that the White House didn't want it to be released, I really wanted to read it to see what they had to say. And they were very cautious, as I think we should be. I had to look at churches and other houses of worship because we met with a lot of the faith leaders who were anxious to see us figure out how we can reopen churches in a thoughtful way. And I noticed that the CDC guidelines that said for phase 1, phase 2, and phase 3, vulnerable populations should not be going to church. And that's people over the age of 60 or 65. That's folks with some pre-existing conditions. They recommended face masks for the next duration, for the foreseeable future. Interesting that the CDC put that out for the not just the near term, but the longer term as well. And this one got to me. The CDC guidelines for religious services also said no choirs. Singing seems to project the germs in a certain way. They said if you have to, go with a soloist. So I can see why the White House is maybe hesitant to release the CDC guidelines, but it does give us some guidance in terms of where we think we ought to be going forward. So David is going to walk through a few industry sectors that we are allowing to open if they want to come May 20th. He's going to start with restaurants, and it's worth remembering that we've said restaurants for outside dining only, which again is a metric that tracks what the CDC has recommended as well. Offices, like restaurants, no more than 50% capacity, and probably recommending that only half your team go in, and then another half go in at different times, so in case there is an infection, you're limited in terms of what the spread is. You know, retail, as you know, that we've kept most of our retail open, even compared to our peer states. Much of it, though, is for a pickup and not for walking in. So David will come through with some of the parameters we have that allow you to get back to some form of shopping again on our main street, provided you follow the parameters very strictly in terms of masks and distancing and the such. And finally, and this is probably the most complicated for all of us, are the personal services. Personal services, as we thought about it, is nail, hair salons, barber shops, and the such, places that don't come naturally to maintaining a social distance, but services that a lot of people do consider essential to one way, shape, or form. And we struggled with this a little bit. And David and the Reopen Connecticut team, working with the associations, came up with some very strict parameters as regards the nail salons. And there was a sense maybe that was too expensive, too much, too soon, and maybe we should hold back on that for a while. At the same time, we talked as regards hair and barber shops, and David and Josh spent a lot of time talking to OSHA as well as the associations. Probably a sense that perhaps we can go forward with that, but we'd like to hear your feedback. I know there was some worry that, look, nobody has to open on May 20th, but people said, well, if I don't open and my competitor does, then what does that mean? It's worth remembering that Rhode Island is going to be opening their hair salons and barber shops in about 10 days. So we do have that regional effect as well as we think about what the right balance is going forward. So with that, let David walk through the protocols a little bit. We'll get your feedback, some questions, and again, Susan is here to answer further questions, as is Josh and Paul. David?
Great. Thank you, Governor. So as the Governor mentioned, we want to go through the Reopen guidelines here. And first, I want to go through a couple of principles. Indra and Albert talked about much of this yesterday, but I think it's important to rehash some of this as we embark here on reopening the state's economy. You know, first and foremost, safety first. The lens that we're looking at this through is public health. As the Governor mentioned, there are public health experts, occupational health experts on all of the committees as we're putting forth these guidelines and rules. Second, it's science-driven. It is clear that the numbers are going to drive how we reopen the economy and how we can measure how well we are doing it as we embark. Third, prepared. You know, we're working very closely under Josh Jabal's leadership here with hospitals and health systems to make sure that PPE is available and we have capacity in those systems, as you heard yesterday on the 7 metrics. And fourth here is a really important one, which is choice. As the Governor mentioned, May 20th is a date where we're allowing businesses to open. What we've seen in other states, though, is not all businesses are going to open on that date that can open, and not all consumers are going to be ready to consume those services on that date. So this really comes down to choice for the individual business, for the employer, if they want to open on that date. And what I expect is May 20th won't look too different than May 19th in a lot of areas as people get comfortable with reopening the state and look for more of the data and the economy starts. So it's really important that the choice is the individual business owners as we go here. The state is not mandating it, and the state cannot mandate it. We have rules that we think can ensure safe business and safe consumption of goods and services that we're going to go through, but that choice really comes down to the individual. And lastly, as the governor mentioned here, with some of the feedback we've gotten from nail salons in particular, employees and owners, this is a dynamic process. We want to engage on the health side and on the industry side as we reopen the state. So let's get into a bit of the guidance. First, the social guidance. As the governor referenced the CDC guidelines, a couple things we wanted to underscore, and these are not going to be different on May 20th than where we are today. First and foremost, face masks or cloth face coverings are going to be required to be worn at all times in public, especially where you cannot social distance from other people. Gathering size is currently limited to a maximum of 5 people. That will continue on May 20th. That's very important for us as we reopen the state. And then lastly, but perhaps most importantly, residents that are 65 and older or have high risk factors are encouraged to stay home. So that is not go back to work and not go to consume some of these services at establishments that are going to be open. So that will continue on May 20th, and we will continue to communicate with the public as those factors change. But that's really important across all of these businesses in our state. So getting into some details here, restaurants first. So there's 3 factors we're going to talk about. First is physical setup. We're going to limit restaurants to outdoor dining only, tables placed at least 6 feet apart. Bar areas are going to remain closed, as well as any recreational areas. So if there are playgrounds, dance floors, all of those amenities or additional areas cannot be open. And we're really going to encourage contactless payment at restaurants as well as other places. Second, cleaning and hygiene, really important here as we reopen the state. So high contact areas and bathrooms cleaned frequently. That could mean hourly or more than that for certain restaurants, or a little bit less depending on how busy the restaurants are. Tables and chairs will be required to be sanitized and cleaned between groups. We're going to ask for paper menus or to post menus on a whiteboard or a chalkboard. Disposable menus or menus on a wall is going to be a requirement. In addition, silverware needs to be packaged or rolled silverware. We're really trying to focus on eliminating touch points between customers, and those are 2 important steps. And then lastly, we've done some surveying. Hand sanitizer is really important in terms of cleanliness, but also from the public to get back and to get comfortable going into restaurants. Seeing hand sanitizer being available at the entrance and exit of a restaurant is really critical to the public understanding that hygiene is important in these institutions. Lastly here, protection. So employees are going to be wearing face masks or cloth face coverings in restaurants. Table servers are going to be wearing disposable gloves that are going to be changed frequently. And customers are going to need to wear face masks too, or cloth face coverings when they're moving about the restaurant. When you're at the table or when you're eating your meal, of course you will not need to wear a mask. But when you're moving to the table or to the bathroom, you will need to have a mask on in the restaurant. So one of the other things that we're doing, and DECD will put this out later tonight, is we're providing guidelines for all of the businesses that may open on May 20th. And included in these guidelines is going to be diagrams like the one you see here. This is a new restaurant, or what the new normal is going to look like for certain restaurants. So we're really trying to provide as much reasonable detail to not just employers and employees who need to be trained in a lot of these rules, but also to consumers to understand what the restaurant's going to look like on May 20th and why that's very different than what they previously saw. Next up is offices. So first and foremost here, we're limiting this to a 50% occupancy capacity. But the real thing we want to communicate is if you can work from home or you can work remotely, you should continue to do that. We're providing flexibility for folks to go into the office, whether it's a day a week or for a specific meeting that might need to be done in person. That flexibility is there, but it's really important that those that can continue to work from home or work remotely do so on May 20th and afterwards. There is going to be a 5-person limit to meetings, and we're going to make sure that employees are going to be seated 6 feet apart. So empty desks, empty cubicles, you're going to see that in the new office. And where there are not physical partitions, whether it's plexiglass or something else, we're going to ask those to be put in where that's possible. Lastly on this page, elevators. Elevators are inherently a very difficult place to social distance. We want to make sure that elevators are very clear in terms of how many people can go into them. And in addition to that, we also want to make sure there's not a big line in the lobby, for example. So there's a balance here, and we've all seen grocery stores have done a great job marking off 6 feet on the floor. We expect to see that in our offices as well. Hygiene. So again, high contact areas need to be cleaned frequently. Common areas like lobbies also need to be cleaned very frequently. We're going to really limit any sharing of any equipment where that happens in certain offices. And then again, hand sanitizer. I can't stress that enough. Employees in offices, again, will be required to wear face masks as well as or cloth face coverings, except when they're in their own private office. And then ventilation. One of the things we've learned is ventilation is critically important to reducing the transmission of the virus. So where we can increase airflow through open windows, for example, that is very much encouraged in offices and other places. So again, we don't need to go into this great detail, but in the guidelines we'll put out, we're going to provide detail on the new office to make sure we spell out graphically what a lot of these new rules look like. Shifting to retail, as the governor mentioned, there will be a 50% capacity restriction here as well. Fitting rooms are going to be closed as we start up retail. In addition, physical barriers at checkout. We've all seen this in grocery stores. They've done a great job managing the checkout with plexiglass. We're going to ask for that to be done in all retailers, in addition to the 6-foot markers on the floor to make sure social distancing happens. Anything self-service will continue to be closed. And again, we're really going to strongly encourage contactless payment as we go forward. In terms of cleaning, again, hand sanitizer and wipes at entrance points or exit points is going to be really important. Cleaning of bathrooms frequently, again. And then high contact areas in retail that are shared. So carts and baskets, door handles, and credit card machines where they're used. Again, face coverings are going to be required by both employees as well as customers here on May 20th and beyond. Same thing with retail, more details to come in the DECD guidelines on this. Last sector here is hair. So on the hair, I want to spend a bit of time. We're going to have hair at appointments only, and the waiting rooms are going to be completely closed. So appointments only, that can be done over the phone, over the internet, or that could be a clipboard on the door, as simple as that. But we want to make sure that we don't have people congregating in our hair salons. Workstations are going to need to be at least 6 feet apart, and again, where we can put physical barriers between workstations, that's going to be required as well. Again, contactless payment, that's something we're really emphasizing across the board. For hair services, tools need to be soaked in disinfectant between clients. Hand sanitizer, again, something that we're asking for everywhere. And then high contact areas cleaned frequently. Limit conversation where possible. Again, the spread of germs, even with workstations 6 feet apart, we're really trying to limit in hair salons and barbershops. So in terms of protection here, we're going to ask for face masks as well as face shields or eye protection in hair salons. Employees are going to need to provide a clean smock for each customer as they come in, again, by appointment only. And customers are going to need to wear face masks the whole time or cloth face coverings. Again, where possible, increased ventilation and airflow. That's something we would like to see, whether that's leaving the door open or leaving a window open. We really want to encourage that. One thing which isn't on here, but we've been asked a couple times, but blow drying or the use of blow dryers will be forbidden in terms of moving potential particles around a salon. That's something that will not be allowed. There's the new hair salon or the new barbershop of tomorrow. Again, will be in the guidance that comes out later today. With that, I'll turn it over to the Lieutenant Governor.
Thank you so much, Commissioner. Thank you, Governor. When this COVID-19 public health crisis began, I started to have teletown halls with small businesses across the state because they are the backbone of our economy, and we wanted to make sure that we were in constant touch with them. So I've held teletown halls with small business owners in each of the congressional districts across our state. And on Tuesday, I had a virtual town hall led by the Women's Business Development Council and their CEO and founder, Fran Pastore of Stamford. And on that day, we heard from more than 120 hair salon and nail salon owners and operators. And these were almost exclusively women small business owners who are very well known in their communities, and they expressed their concern over their ability to maintain social distancing in the hair and nail salon setting. For the nail salon operators, they said, you know, how can you have someone just sitting a few feet away and have that personal contact where you're touching the client's hand? How would it be possible to maintain the appropriate social distancing? So we want you to know that we heard what you had to say. We also heard from, as I mentioned, many hair salon owners who are expressing concerns over having access to PPE equipment. I talked to one hair salon owner in Montville in eastern Connecticut who said that a month ago she ordered PPE equipment for herself and her staff, and she has yet to receive it, and she is extremely concerned about opening. So the governor and I want all of these hair care professionals to know that we have heard what you have to say, and we are looking forward to hearing what you have to say about the guidelines that the commissioner and the Reopen Connecticut committee is putting forward today, because we still have time before May 20th to tweak and make adjustments. And we want you to know that we are still listening to you, and we think what you have to say is critically important. I think, as the commissioner was stressing, if you do decide to reopen, because this is not a mandate, we hear loud and clear your concerns about your competition opening down the street, and you've not opened. We want you to feel comfortable. We want your clients to feel comfortable. And so we are looking forward to continuing this conversation because we've tried to put forward some guidelines that will keep you, your employees, and the residents of our state safe. And I think that the commissioner has tried to put forward guidelines that will show you a different kind of business model, at least for the beginning, because we're taking small steps toward reopening. So appointments are going to be required. We're going to have less people in the salons. There are not going to be double bookings, lots of people in waiting rooms and waiting areas. So we're looking forward to this continued conversation because we want everybody in our state to feel comfortable. All of us have longer hair and we can't wait till you reopen, but we're willing to wait until it's safe to do that. The other thing that I did want to mention also is that our office will be announcing formally on Monday, along with the Department of Education, that we have a computing challenge for our students. And this challenge will be open to third grade students through 12th grade. And what we're asking is we're asking the students around the state to put on their thinking caps with their teachers and their parents and come up with ideas that can help us defeat the COVID-19 virus. And we're looking for your ideas for apps that might defeat the spread of the disease, that will provide aid to our local or global communities, and that will encourage or inform others. And this challenge was inspired by the Governor's Council on Women and Girls, and in particular, the Education and STEAM Subcommittee, that subcommittee that encourages girls and young women to study science, technology, engineering, arts, and math, because right now girls and young women are underrepresented in that field, all of those fields. And so we're inviting all students, male and female, third grade to 12th grade, to join that computing challenge. We'll have more details for everyone on Monday, and the deadline will be May 29th. So thank you, Governor, for allowing me to participate.
David, thank you very much. Any questions, Max?
We'll start with News 8.
The blow drying, if they can do it outside, how do you style hair without blow drying?
Who wants that?
Hey, you can color, and there's a lot of us that would really like that part, and you can cut.
Got it. That makes sense. And if your chairs can't be moved, can they put partitions between them? We've seen some salons with photos already of like plastic partitions between the chairs because they can't be moved 6 feet apart.
Yeah, if that's not possible, putting a physical partition between them is sufficient.
Channel 3 Eyewitness News.
Hi, yes, I got a message or question rather from a viewer, and they asked, in a dental setting, patients cannot wear masks. They are extremely close and there is no safe distancing. What does this look like when they are dealing with saliva and other things? And also, some viewers are wondering if malls fall under the non-essential business and can they reopen May 20th?
So I'm happy to take both those. So the American Dental Association, I believe earlier this week, put out guidelines for they called it a toolkit to reopen and reopen safely. And the Connecticut Dental Association has linked to that and put up a comment on their site. We're mindful of the proximity of a dentist and a hygienist to their patient and how close saliva is there. So we're referring dentists to, and a lot of them have made us aware of it, the ADA guidelines in the toolkit as they start to do cleanings again. And their normal course work. On the Mall's point, malls will be part of retail in the reopening on May 20th, or they'll be eligible to reopen on May 20th, subject to guidelines.
NBC Connecticut.
Good afternoon. The Lieutenant Governor touched on this, but Governor, I want to get your take. What is your message to salon owners who say, and I quote, "The governor is using the salon industry as guinea pigs in an unprepared, untested reopening plan"?
That we want to work with the salon owners, and that is what we've tried to do. And we tried to come up with metrics and protocols that allow you to open safely. In a way that you feel safe, your employees feel safe, and your customers feel safe. And of course, if you don't feel that this is the time to do it, there's no need to open now. That's totally at your discretion. And so we're going to wait and listen now to the feedback we get, as Susan said, and figure out what the next best steps are. Right now, we think that the hair salons can open safely. We've worked closely with them, worked closely with the OSHA and other groups that feel like we can do it this way, but it doesn't work unless you feel the same way.
And I would just add to what the governor is saying is that I believe next week there will be a teletown hall that Fran Pastore is organizing for the governor to hear further from hair salon owners. So we would love for hair professionals to take a look at the guidelines that the commissioner has put forward. And we are eager to hear from you because if you as an industry feel that, it's important for us to take other things into consideration, we are all ears and we appreciate your professionalism and any suggestions that you have.
And secondly, Governor, there's a Groton lab doing human trials on a coronavirus vaccine. Can you tell us about any kind of communication you've had with them?
I have not talked with them. Obviously, we've been to Biomed and others that are working on vaccines and therapies. I don't think I've talked to that particular one. Josh, does that ring a bell with you?
Yeah, it does. We're in touch. They're keeping us apprised, as many of the other leading bioscience companies in the state of Connecticut who are doing so many innovative projects trying to attack this virus right now.
Thanks.
Thank you.
Fox 61.
What exactly is the reopening plan for dental offices when it comes to non-emergency procedures? Has it been decided what phase will they reopen? And can employers, dentist office, quote unquote, force their employees to come back to work before those dates?
So dental offices have always been an essential business, just like other parts of healthcare in Connecticut. So we've not deemed them non-essential during the virus, or when the virus was very prevalent here in the state and others. Our dental association, as well as the American Dental Association, recommended not doing cleanings and regular visits and just focusing on emergency services. So as the American Dental Association and other states come back online for cleanings and hygiene, they're able to do that, and they're able to start doing that as they see fit and as it's important to them to resume that safely under the ADA toolkit.
So just to confirm, emergency services, non-emergency services like checkups and cleanings, they can come back like soon as tomorrow or May 20th if a dentist's office feels comfortable and has the PPE and wants to do that, correct?
Yeah, as of now, that's correct. And this comes down to the comfort level of the dentist and making sure that they're following that toolkit, which is important from the ADA, to resume the dental procedures.
And then now that these guidelines are out there, Lieutenant Governor, you said you want to hear from nail and hair salon owners. What's the best way for them to voice their specific concerns straight to your office?
I have an email, which is ltgovernor.bisowitz@ct.gov. And also, when the teletown hall is finalized on this issue, we would love for any hair professional or nail professional to participate. Although I did think, and I'll get clarification right now, I think, did we say that the nail salons won't be opened on May 20th?
Nail salons, that is a change. They will not be open on May 20th. They will be open at a later date, potentially in phase 2.
So I do want to make that clear. So we'll be focusing next week on the hair professionals.
News 12 Connecticut. WTIC 1080 News.
Hi, guys. The restaurant hygiene seems like a lot of work. Are you anticipating that any restaurants that might have been planning to reopen with outdoor seating might think twice now that all of that has to be done?
We don't think so. I mean, as the governor mentioned, we work collaboratively with the Connecticut Restaurant Association as well as many others on the rules that are going to be put out. I think one of the questions which has come up more is, outdoor seating only, which is what's possible on May 20th in no bar areas. Restaurants, understanding where we are in the season, how much incremental business they can do. We want to encourage them to do as much incremental business as possible and as safe. But I think restaurants will be able to comply with the rules that we put forth. And again, we did it in consultation with them and others.
I'd only add to that, if you want, that what we worry about looking around the rest of the country is the consumers may not feel comfortable going to restaurants initially. It's not like the end of Prohibition where everybody went running into the speakeasy and said, here we go. So the hygiene is very important to giving consumers confidence that they can go back to the restaurants. That's why I think starting outside is a way to get them more involved. And we've worked closely with the restaurants as we put together these protocols.
And also, if I could just add to that, Governor, the Ag Department and our food security group has been working with restaurants so that they can provide meals to seniors, to healthcare workers, and the like, to people who need food, because we want to keep those restaurants going. We know they're so vital to our main streets and our cities and towns, and we want to keep them going as much as possible until we get to the other side of this.
And enforcement, are there going to be specific enforcement guidelines for consequences, or are we doing the honor system?
No, there will be specific enforcement guidelines that we're currently working through. This will all be codified in an executive order likely early next week, but we understand the importance of compliance here. In addition to the enforcement guidelines, we're going to ask businesses to attest to the rules on the DECD website before they reopen as well.
The Associated Press.
Good afternoon. I was just hoping you could follow up a little bit more on those enforcement guidelines. Are you talking about local officials monitoring to make sure that these businesses are following these rules, or would there be state agencies involved? And realistically, what would be the penalties?
Again, it's still being worked out, but practically speaking, we are going to need to look to local officials to help enforce this, just from a scale perspective as the economy reopens. And ultimately, we're focused on public health here. So the question is potentially the licenses that are available to operate in terms of public health. Those could they be revoked, or should they be revoked for some period of time if there is noncompliance? So again, we're working through all of that, but I think we are going to need local help in terms of enforcement.
And regarding the restaurants, and I'm sorry if I missed this, do any of these rules apply to the workers inside? I'm thinking you have people pretty close together cooking the food.
Yeah, we're very focused on employee safety in particular here. As the governor mentioned, we had many OSHA representatives on the committee that was developing the final rules. So the employee safety, very critical. There's going to be required training of employees as well as the posting of these rules and making sure that everyone is aware, including the employees in the kitchen, on this.
But are there limits on the number of employees inside the kitchen?
Well, it depends on each kitchen. We're at some point we're going to not be as prescriptive, but ultimately where we felt it was appropriate to provide limitations, keeping the safety front and center, we did that.
Thank you.
The Connecticut Mirror.
As you reopen, obviously one of the issues you're going to be dealing with is the comfort of workers going back to work. So to what extent have you worked out what will be the rules for unemployment? You mentioned that you want people who are at risk or older not to go back to work. Will they continue to be eligible for unemployment should their workplace call them back?
My answer to that is yes. As you saw from the CDC guidelines we got from Washington, as well as our own guidelines, that vulnerable population over 65, comorbidities, they should not be going back to work for the near term. And given that a restriction, they would be eligible for unemployment compensation.
Is there written guidance on that yet, or will there be? Because there are going to be a lot of questions about any gray areas on that.
If they're not now, there will be.
All right. And one of the things that struck me from Commissioner Lehman's comments, he was talking about the design of the new barbershop, the new restaurant. That raises the question of what should our expectations be about how long we should expect to live with these kinds of restrictions and new ways of doing business?
Well, go ahead, David.
I was going to say, Paz, I think you're bringing up a really important point here, and I think the reality is the occupancy or the capacity of these businesses is just going to be less as we get started here, and we're gonna understand when can you go from 25 to 50 or higher as we learn more about the virus and our ability to contain it with all the other interventions that were discussed yesterday, like contact tracing and the syndromic surveillance. But I think you're going to see just less crowded retail, less crowded restaurants, and then when we talk about lodging and other businesses, I think that until we understand what the cure is or a therapeutic or a vaccine, you're just going to see a lot more spacing in these restaurants and retailers, which is very hard for them from a business and from a margin perspective. So we're very focused on capacity, but from a public health perspective, it's critical right now, and I think that is the new normal.
And last question, what's the rationale for, you're going to allow a couple dozen people to be in a boutique but not allow a couple dozen people to dine in a restaurant? What is the rationale for treating them differently?
I think there's two things, Paz, there. First, when you're in a restaurant, you can't wear a mask the whole time. Inherently, you're eating a meal. In addition to that, your time in a restaurant is typically 45 minutes, an hour, or longer to have that meal. Whereas if you're going to go into a boutique or into a toy store, you're going to be there for a short period of time, and you can wear a mask, and then you can leave. So just the nature of the interaction is less and safer.
And Paz,
thank you.
Paz, if I could just add to that, I was talking to the owner of a boutique in Hamden earlier this week. She has 2 rooms, and she's already decided she's going to start with 1 other employee in addition to herself, and she's going to have 1 client in each room. So business owners have already started to very creatively think about how they're going to manage it and how they're going to do it in a safe way for themselves, their employees, and their clients.
Thank you.
The Day of New London.
Good afternoon. It's Karen Florin from The Day. As Memorial Day approaches, our local beaches are becoming a patchwork of inconsistent rules and guidelines. Some are closed entirely. Some are open to residents only. Governor Lamont, will you consider issuing some guidelines for the municipalities?
Yeah, Katie was on the phone, I think as early, probably this morning, with all the municipalities, talking specifically about municipal beaches, municipal parks, Obviously, we know what we're doing with our state beaches and state parks, where we specifically limit the amount of parking that can go on there, and trying to get consistency with all the municipalities. They are looking for guidance on that. And as I mentioned before, I'm talking to my other governors in the region. I mentioned that Rhode Island will be opening their parks and beaches. I think it's this weekend. May not be a great weekend, but opening it, so we get that better coordinated as well.
Thank you. And is there any talk yet of when hotels and inns might be allowed to reopen for the public and take reservations?
So the Reopen Connecticut is currently evaluating that, and our plan is to come back and present what Phase 2 and Phase 3, the industries that are in those phases and the approximate time of those phases, potentially late next week or early the following week. So stay tuned on that.
I'd only add that our regional governors, when we talk, I'm afraid that hotels are not in the very first tier, just because people want to do what we can to discourage a lot of interstate travel back and forth. Probably a Tier 2 opportunity.
Thank you.
Connecticut Public Media.
Ali Wachowski for WNPR. We heard from a listener, she doesn't fall into that category of being at risk or over the age of 60, but she's a hairstylist and it is concerned that she could be forced back to work. So what happens if you're someone who's simply scared, doesn't believe your workplace is safe enough? Are you still allowed to file for unemployment or partial unemployment if you choose to come in to work at a hair salon or one of these retail stores extremely part-time?
Well, I can say, as a small business person, look, the salon is going to be maybe working at half capacity if everybody comes back as scheduled. My hunch is they won't come back. That would give you as an employer an opportunity to tell that person you're free to go be furloughed. And because if you don't want to come back, we've got other people that can come back. And you're free to be furloughed and also be eligible for unemployment compensation. I think it will self-regulate and work its way out. And if it doesn't, we'll take a second look at it.
The Hartford Courant.
Governor, you've spoken with a lot of confidence about this May 20th date, and I understand that most of the indications are moving in the right direction. Are you ready, or is there a plan if there were a flare-up, if hospitalization started to increase, if testing didn't ramp up, if some of these other metrics weren't hit? Are you ready to pump the brakes on this May 20th date and push it back?
Yes, is the answer to that question. I'm confident that given the facts we have today, we are making the right decisions and the right balance in terms of public health and allowing us with baby steps to slowly get back to work. That said, I'm never confident with this COVID it's going to be in the next week or 2 weeks. We're detecting all the time the possibility of flare-ups. I see flare-ups in Texas and Georgia and India and overseas. And so, as you probably heard from the Higher Ed Committee, I guess that was maybe even yesterday or day before, they said, look, every university is going to have to plan on students being able to get back. And in case they can't, in case there's a flare-up, they got to also plan in terms of distance learning. And I think all of our retail and other business services are going to have to think the same way.
And so then after that May 20th date, you've talked about, you don't know what's going to happen, and if there were a flare-up, you might have to dial things back. Will there be any sort of extra monitoring of people, say, at hair salons or nail salons to be able to catch a potential flare-up quickly or immediately?
Yeah, that's one reason we're ramping up the testing in a dramatic way, and that's antibody testing so we can see in the general population what the infections are, as well as PCR. As I mentioned, I think yesterday, some of our manufacturing, in terms of including electric boat, they're going to be testing everybody going in. We've got the smart thermometers out there. We've got the apps, so we're doing everything we can to see if we can see, it's almost like a fever map for the state. And if there looks like there's a flare-up, we can get there ahead of it.
I guess my question is, will there be any way to know that there are specifically flare-ups surrounding certain types of businesses like hair salons or nail salons before it's too late and before that transmission has really gone widespread?
I think the track and trace will be one way we'll be able to tell that quickly. If we saw that there were a number of people who were infected And through the track and trace, we traced it back to nail salons. And we found that would give us some insights there. I think we can track that.
Thank you.
Hearst, Connecticut Media.
Thanks, Max. Hey, David, this is Ken Dixon. Have you been able to figure out in this initial phase of bringing restaurant workers back, what percentage of the 160,000 some odd employees will be coming back to work in this first phase?
So it's a great question, and we've looked extensively at the unemployment claims data. But as the governor mentioned, Ken, it's too early to tell because we're not sure. We've seen lots of survey data on how many consumers are ready to go back into that restaurant, and we're going to see that real time here later this month. And then some restaurants are going to make the decision that they can't do outdoor, or with the weather, it's harder for them to basically make money or make it work for them. So we're going to need to see that here as we embark in late May and early June, and we'll report back. But right now it's just too early to tell. But my expectation is that this is going to happen very slowly, and that's what we'd like to see, the baby steps.
Governor, the restaurateurs I've been talking to are totally respectful of the advisory group. That they think maybe that there's there's a need for more expertise, and a lot of these people seem to have good plans to open inside. And as David said, the margins, the profit margins are tiny. Have you thought, you and David, phase 2, phase 3 to bring some people inside, or is it just the baby steps thing?
No, I can see what we want to do in phase 2 and phase 3, as you say. We wanted to start with the outside, start with the drop-off program that Susan was talking about, so we give the consumers some confidence in terms of getting back to the restaurants and that type of normalcy. And we can track from there. The Restaurant Association is part of our Reopen Connecticut Task Force, so they were there giving their input along the way. And the restaurants wanted to open up a little faster. The nail salons wanted to open up a little more slowly. We're figuring that out.
I would just say also, Ken, I think what you're going to see with a slow and steady reopening is that it in and of itself is going to build confidence. I actually think over the medium term and longer term for restaurants in the Connecticut economy, that is better than trying to go too fast and potentially taking risk where we need to dial it back. So I think a slow and steady opening is the right thing for restaurants and for Connecticut over the longer term. One thing I should just mention briefly, and we're working very closely with the governor's legal team on an executive order that will afford restaurants the ability to utilize their indoor alcohol licenses outdoors. The municipalities where they sit will clearly weigh in on this as well. But from the state's perspective, we're trying to make it very easy for restaurants to turn on that outdoor dial should they choose to on May 20th.
Yeah, they agree with you on the use of the word confidence for the consumers. Thank you.
Thanks, Ken.
CT News Junkie.
Thanks, Max. I wanted to know when specifically this guidance is coming out.
Christine, our goal is to get it on our website later tonight. It's currently being finalized right now. If it's not there late tonight, it'll be there first thing tomorrow morning.
And what about restaurants and hair salons? Where are they going to be able to source cleaning products, cleaning supplies, in addition to PPE, which some of our healthcare workers are having problems accessing?
Sure. So one of the other initiatives that we're working on right now is a committee on how to implement the guidelines, where to find those cleaning supplies, where to find that PPE. So that's something that Lisa Tepper-Bates and Glenn Thames have set up a team, and they're working to do that. In addition, there's other initiatives around a marketplace where vetted suppliers that have some of this equipment put in the right restaurants or the right retailers in touch with them. So that's all part of this committee, and then we're going to try to get that report out as soon as we can.
Okay. And this doesn't include gyms, correct?
That's correct. Gyms are not able to open.
Okay. Thank you.
Boceto Media.
Good afternoon, everyone. In a previous press conference, New York Governor Cuomo said that the federal government should nationalize medical supply acquisition. Since Connecticut is part of the Northeastern Emergency Coalition, will there be any plans to establish new manufacturing in Connecticut to make PPE supplies in American soil to create new jobs in our state?
Yeah, that's a very good question. when we put together the regional purchasing cooperative that you just referenced, we were thinking about how we have a lot more market clout by working together. We're able to buy more, get more access, either from the federal stockpile or more likely from China and overseas. But longer term, we want to be able to do this ourselves and not be dependent upon supply chains that go all the way to Wuhan province. And so there we're working together in terms of pharma, mass, vents, different places where we can share different responsibilities there so we have more of the local production capacity. It's not going to be done overnight, but it's a lot easier to do together.
And with all those efforts from all the other states in conjunction, what would be your criteria, and how long will it take to Connecticut to stabilize its economy after phase 1 and 2 of the reopening? Thank you so much.
Did you follow, was that in terms of purchasing?
Yeah, was the question, just to be clear, how long will it take to get our unemployed back working in the economy?
Yes, after phase 1 and 2 of the reopening. Thank you.
Yeah, so our expectation right now is there's potentially 3 phases of the reopening over the course of the summer. And some of you may have seen there was a report this morning where at the federal level there's 15% unemployment right now, so significant unemployment. It is too soon to say how quickly, whether it's 15% or 20% or more at the end of the day, how quickly we can get folks back to work. But we want to get folks back to work as quickly and safely as possible. But if previous downturns are any guide, it does take a lot longer to get people back to work than the layoffs that we've seen over the past 6 weeks. But our goal is to work as quickly as we can to make sure that the economy is going as fast as possible, but making sure it's safe.
The only thing I'd add to that is we're finding as we got into this and as we get out, as we look at our other states, it's not simply a matter of opening up Main Street and the economy comes back, that so-called V-shaped recovery. We're finding out that store owners have some hesitancy, consumers have some hesitancy, employees have some hesitancy, and that's why the public health parameters of this are so important to give all those groups confidence. That's how that recovery is a little more accelerated.
Waterbury Republican American.
Thanks, Max. What about campgrounds? The DEP, I believe, has closed state campgrounds through June 11th. I believe your earlier executive order on lodging covers private campgrounds. So what about campgrounds?
So, on the state campgrounds, I think that's under discussion. I'm not up to speed on that from a deep perspective. But private campgrounds will be able to open with outdoor recreation on May 20th. So, as the governor's mentioned previously, outdoor recreation, especially as the weather gets better, we understand how important that is for families and individuals. So, campgrounds we thought was an example of an avenue that we could let folks do that was safe as well.
And our team at the Department of Environmental Protection is working to get the state campgrounds open as quickly as possible. There's some lead times there with regards to getting the staffing organized, getting the protocols set up to clean the common bathrooms and those sorts of things, but they're working on that right now.
Okay. I also saw a copy of what's purported to be a draft executive order that would essentially put municipal planners or zoning enforcement officers in charge of deciding whether or not to allow an outdoor activity such as permitting a restaurant to set up tables on the sidewalk or in a parking lot, and then they would have 10 days to approve a request. Otherwise, it would automatically be approved, and there would be an appeal to the Land Use Board of any denials. Is that going to be happening?
So that order is the one that I referenced previously in terms of affording flexibility for DCP licenses using your indoor license outdoors. We are trying to fast track with the municipalities to make it easier for them to make decisions to help their retailers and restaurants. I'm not sure ultimately where it will end up, but there is language in there to enable municipalities to act quickly to allow this outdoor commercial activity.
And there's plenty of municipalities that don't allow those sort of activities. And if municipal leaders, if a mayor, first selectman, town council say,
we don't want to take the risk of opening up a restaurant and exposing people to infection. So, sorry, you can't open in our town. They'll be able to do that, correct?
Listen, this needs to work for the municipalities as we reopen the economy. So at the state level, we're trying to provide the toolkit to do this quickly and we believe safely. But if certain towns have the view that they don't want their restaurants having outdoor space or their retailers doing a sidewalk sale, they will have the ability to say no to that.
Okay, thank you very much.
Yeah, I think that sums it up in the sense that local municipalities will determine what they want to allow their restaurants to do. Restaurants will be able to make the choice when and how, when they want to be able to open. How is going to be determined with us, starting with the outside. As I tried to say before, it's not simply a matter of flicking that switch and everybody goes back. We have to give customers and consumers confidence that they can go back, make sure store owners know that they can open up safely, and very importantly, make sure employees know that they can go back. And if they can't go back, what redress they have. These are all the different nuances of reopening an economy, which in many ways is more complex than it was when we had to close things down during the early days of the COVID onslaught. I hope we're getting it right. I know we don't have everything right, though, and as Susan said, we're going to learn from your input every day and make it better. Thank you, everybody.